It's been over 4 days since Barbados' Queen Elizabeth Hospital was brought to its knees by a cybersecurity attack, and the island's public hospital in the capital of Bridgetown is still struggling to find its footing. On Sunday night, the alarm was raised and all computer systems were shut down. Internet and telephone lines stayed down as the hospital's IT staff, together along with outsourced IT specialists, battled for over 3 days to restore connectivity. A team from the Ministry of Industry, Innovation, Science and Technology joined cybersecurity experts from the private sector to help staff of QEH try to recover from the attack, identify its source, and to equip the facility to mitigate similar occurrences in the future. In the meantime, reports from the local press are that employees were working manually to complete tasks. According to the hospital, the laboratory, radiology, pharmacy, and medical records departments were among those affected. Health workers are currently trying, the hospital says, to accommodate patients needing the services of the operating theatre, wards, units, outpatient clinics, and emergency departments. While nurses and doctors try to fill those gaps, pharmacists are reportedly processing prescription refills by asking people to present their empty medication containers before they can receive a new batch. Despite these efforts, people calling into the facility in need of urgent prescription refills are being told to contact the hospital's help desk, which in turn redirects patients to polyclinics in their area for refills. People with new prescriptions from the hospital's A&E department and outpatient clinics have also been asked to receive their medication from polyclinics. However, other state health institutions, including polyclinics and private health facilities, which depend on the hospital for services, were also being adversely affected by the hospital systems being knocked offline, the hospital said. As of press time on Thursday, hospital services are still disrupted. Calls to the facility's registered telephone numbers went unanswered. Members of the public have been told that medication orders can now be placed online. However, there would be delays in processing and delivery. Patients who requested home delivery of medications on December 12th or 13th via email are being told that those cannot be facilitated and that they would be updated at an unspecified later date. QEH management continues to remain tight-lipped about the consequences suffered as a result of the cyber attack and the implications for affected departments, saying no possible timeframe can be given for the complete resumption of services in those areas. In its most recent statement on Thursday, QEH said people with appointments for CT scans, X-rays, and ultrasounds at the radiology department are unable to have them facilitated. No further details were provided except that the department is working towards reducing the wait time for rescheduled appointments. The hospital added that officials in the medical records department are trying to continue outpatient appointments, encouraging individuals to continue submitting their paperwork for appointments. The severity of the implications of the cyber attack still remain unknown, and with the undetermined timeframe for the rectification of the issue and no other public hospital alternatives, Barbadians are now faced with the predicament of possibly having to seek private medical assistance or waiting with uncertainty. Another issue that comes into the fore is patient confidentiality. Authorities have thus far focused their public comments on how the hospital is managing the resumption of services and have not discussed whether people's private medical information was or may have been compromised. Without providing details on the issue, QEH Executive Chair Dr. Juliet Bino Sutherland promised that, quote, all necessary precautions had been taken to protect patient privacy.